Hi guys, so we are at New York CSG coffee chat, monthly coffee chat, and we are very lucky to have Tuhin with us, who is an alumni of Indian Institute of Science, Bangalore, and he will be talking about his experience with his setting up his startup, which is called as Pandorama, which has to do with Pandoram Technologies. Apologize to him. So, without wasting more time, I will just go ahead and start.
Hi everyone, I'm Tuhin Bhowmick. I did my PhD from Department of Physics, Indian Institute of Science. I'm a crystallographer, protein crystallography, structural biologist by training. But I think the main focus of uh, my short speech over here will be about a startup which we started during my PhD. It's called Panorama Technologies Private Limited. So basically, we founded this, me and one of my colleague from aerospace engineering department in ISC. We started this company which is focused in biotech sector. So I get a lot of raised eyebrows and surprise questions that how from somebody from biophysics and somebody from aerospace come together to build a company in life sciences. But basically the thing is, what we're trying to do is in the field of tissue engineering, and this needs understanding of biology at a molecular level, and it's also a collaborative field where regenerative medicine, stem cells, biomaterial for scaffold formation which builds tissues, and microfluidics for manipulation, all this comes together. So so this is a company which is focused in building technologies uh, for customized organ transplant, organ-based assays of disease model. Like say for example, in case of liver, there are many different diseases which affects liver in metabolic disorders. So to build organs on chip which mimics what is there in our body, but to do it outside in our body gives us a lot of benefits in terms of also clinical trials. So a lot of pharma companies do clinical trial in different kind of animal models, and then finally a drug goes to the level of human trial. But there are huge amount of attrition which happens due to let's say hepatotoxicity, cardiotoxicity, nephrotoxicity, and neurotoxicity. So one of the basic idea of the company is to make small organs or organoids, which is, let's say, taking stem cells or primary cells. I will just stick to for now to the example of liver. So let's say you take from the biopsy sample of a patient, you take out primary hepatocytes and then culture them in combination with other kind of cells in a co-culture in a 3D matrix where it gets the environment as close as it can get inside the body, and it does different kind of cell-cell interaction. It organizes itself into a 3D small organ. We validate the organ and its function in terms of proteomic markers or gene expressions. And once we establish that say in terms of liver, there are some specific markers in terms of also production of albumin, then cytochrome 450, and three different kind of metabolic pathways which liver is active in. So basically, when you take a drug, when it goes to your body, it goes to liver, and in many cases, from a prodrug, it gets converted to the active molecule. But at the same time, many byproducts of this process also causes toxic elements, which is the reason for attrition of many drug trials. So we are trying to recapitulate this whole thing which is there inside the body on a chip or on a plate in this kind of 3D organoid system. But the final goal is also to be able to build these kind of system in a larger scale so that you can put it back into the patient's body, and to, like, in today's date there are lots of people who need liver donation, but a lot of them actually never get the the right kind of organ which can be transplanted back into them in time. So the final goal is to be able to do it that you take the scan of a patient's liver, build a 3D model, a CAD model, and then print it outside the body. You take the iPSC induced pluripotent stem cell from the patient, grow them into hepatocyte, mesenchymal stem cells, endothelial cells. You need more than one, because to recapitulate the whole system, you also need a specific kind of cell-cell interaction. And then put them and print them, putting them in a liquefied matrix, which once you 3D print and cure to a solid structure, basically mimics what is there in your body in terms of like collagen, laminin, and all other kind of extracellular matrix material. So this is the final goal, that you have to be able to print an active organ outside the body and put it back into a patient. But I don't see it happening anytime in the shorter time. And as a startup, you cannot go out with a story which is a blue sky research and nobody is going to give you money, because one very crucial and hard fact is an investor only invests in your company as a method through which he can multiply his money faster than he can do in the bank. So that's why this model goes through these different levels, where you have much, it goes through lower hanging fruits to the higher hanging fruits. And at this point, the lower hanging fruit is to develop this organ on chip, which can be used immediately for drug testing of lead molecules. So you have a system which is, and like let's say if you compare with a mouse model of disease, you still have a lot of differences between human and mouse. But in this case, what we are trying to do is we are trying to recapitulate an organoid which is based on human origins, and so it's more closer to the real thing. And also, if you think of a plate, a 96 well plate, you have 96 organs, and you just put the drug and do the clinical trial in the basic level, and compare that with 96 mouse, and the amount of cost it incurs to the company. So this makes it a lucrative model, and we already have a few Bangalore-based CROs who are very much interested in to get them in their kitty. So this is just a start, and yeah.
Also, Tuhin, I have one question. Not many ISC PhD and especially biology as well as physics guys will suddenly think of, oh, I'm doing crystallography and now I'm moving to this 3D, market, 3D printing organ printing. Right. So what was that eureka moment? Like how exactly, very, very briefly. Like, because I know, based from my experience, ISC is not the place where it is encouraging entrepreneurship that much. I mean, things might have changed now. So I just wanted to know, like, what was your inspiration and what was the impetus and how exactly things, like, what was the first step towards establishing the company?
Okay, so that involves a bit of personal story. So basically, when I was doing my PhD in the third year, my dad, who was a doctor, he was detected with lung cancer, stage 3B, and anyway, so for a long time, I've been with him, understanding the disease, and we have been these discussions that the time when it was detected, if we could donate him a fresh lung, which is, it's not a reality. Like, you have liver transplant, you have many other organ transplants, but you don't have successful transplants, at least many stories of an intricate organ which has like multicellular components and a very sophisticated microscopic structural details. So that was like something which wanted to make me think that, okay, we are all doing science and we are all publishing papers, like maybe papers in great journals of great impact factors, and actually of like a great deal of importance in the research. But when do we actually see our inventions out there helping people? So this was the kind of driving moment, and but I have to say that there was a lot of hand-holding from the Indian government, in the sense like maybe many of you know or many of you don't know that in Bangalore there is this association called ABLE, which is Association of Biotechnology-Led Enterprises. They, along with DBT, conduct this contest called BEST. So it's Biotechnology Entrepreneurship Student Team. And so basically in 2010 we went for this contest with the basic idea of how to make a functional and smart material, which is basically an ink. Like I've been talking about 3D printing. And 3D printing is lucrative because it's a part of additive manufacturing, and it's something which is very useful for rapid prototyping. Like if you have a design in CAD and you have a 3D printer, you can print it. Yeah, of course, given the resolution. But when you talk about printing a live organ, which becomes very important, is what is the ink you're going to use. So how the thing works is you print layer by layer and then you cure it. Cure is the method of solidification. Because if you don't solidify one layer, then by the time the next layer of liquid comes on the top, you lose the information about the spatial architecture. And this happens through this process of this curing happens through the process of cross-linking in general. Now we needed an ink. So now going back to the organ, if you take an organ and you decellularize it, you strip out all the cells from it, you have a scaffold. So in case of liver, if you give detergent treatment and other kind of treatments, you can basically take out all kind of cells, and then you have a whitish matrix which is basically made up of different kind of collagens and other extracellular matrix protein. So what we tried to do is we tried to mimic, and this is also peptide-based, peptide PEG hybrid and peptide different kind of polymer hybrid. So there's a lot of chemistries and conjugation chemistry in this. We tried to build an ink which can harbor cells, and then it can be cured with a wavelength of light which is 455 nanometers. So basically it's a blue LED. And why LED? Because you want the intensity but you don't want the heat. So you want a source which is cold. And we saw that this works very good because cells are happy after you print and even after you solidify. And we can still maintain like 70% cellular viability, which is really good because then it grows back once you put it in a bioreactor. So this is how it started, and at different steps we got different kind of government grants. So we started with BEST, and after we got the first prize in BEST, then there were Vijay Chandru, who is also an ex-ISC alumni and the founder, one of the founders of Strand Life Sciences. So him, and there was somebody else from Wharton School of Business. His name is Stephen Samat. He was there as a jury that time. So these two particularly picked up the idea, and they kind of convinced us that it has a great potential. Like
so great. So you had mentors from that point onward.
Yeah.
Awesome.
And then we applied to. So basically, BEST is also a good platform because you have DBT already involved. So that time there was a senior scientist from DBT called Dr. Natesh, who was a part of the jury session, and he said that why don't you go to the government and pitch? And we went and we pitched, and that time there was no structure available to fund us, but it was in process. So in 2012, this funding structure came online, which is called BIG, Biotechnology Ignition Grant, and we were one of the first people to get the grant. And this is like 50 lakhs rupees over for 2 years of time, and you have set timeline and milestones, and you have deliverables. So this is how we first had enough in let's say, what should I say, proof of principle. We established a proof of principle
with that 50 lakhs.
With that 50 lakhs and 2 years, and we also got incubated in CCamp, which is in the NCBS-based Bangalore biocluster. And then we had the first 2 IPs out of that, and then we got a next level of grant, because then you are already a part of a pipeline, and you already know people in the government,
right,
and who is looking at you. So things get easier then.
So you already established a network there.
Yes, absolutely.
So coming about IP, so how smooth are these processes? Like, how was CCamp experience? How was IP experience?
We didn't at all go by CCamp for IP.
Okay.
So the thing is,
in general, like, how was the CCamp experience as an incubator space? And about the IP, what were the, because I don't know about like the Indian IP scenario, and what are the challenges you are getting.
Sure.
Right.
So there is one. Again, I go back to BEST, because in the jury's panel there was one lady.
No.
There was this lady called. Her name is Lakshmi Kumaran and Sridharan. Yeah. So she runs an IP, one of the leading IP firm with Indian government. It's based in Delhi. It's called L&K. It's basically Lakshmi Kumar and Sridharan IP firm based in Delhi, and they came into limelight recently because they were fighting the case with Ranbaxy versus Roche, I think. No, Sun Pharma versus Roche. It's about like one of these high priority drugs which was like kind of copied and reverse engineered and sold in like 1/100th of the cost in India, and then of course they got sued, but then like every company is governed by the law of the land. So Sun Pharma built their case under this, that like the drug which was built, which was made by Roche, it was like 2,000 rupees one tablet, and this is an anti-cancer drug. And they made it like in 100th of the cost, and when they were selling it. I mean, of course, they skipped all the cost of the R&D because they reverse engineered. Basically, they bought the drug, they did crystallography, founded the structure, and then they built an analog. But But anyways, because of the fact that it saved a lot more lives, it reached a lot more people. So they got something called compulsive licensing, I think. Or I no. Anyways, like the fact of the matter is, if you're selling something which is basically at the end of the day saving a lot more of lives, then at least within that land of the law, you get the opportunity to sell it. So
Right.
this was the case which was fought by Lakshmi Kumar and children, and they won it against Roche, which was also a big landmark.
Okay.
So these are the people who have been filing our IPs.
Right.
So because we are connected to them before we were connected to CCamp, we didn't go through CCamp for our IP, but CCamp is a very good platform for many different things, and one of them is providing you a very good collaborator in academia. Like we have a collaboration with NCBS for making to make this liver organoid into a disease model to study Plasmodium vivax infection. Because like when you have the Plasmodium vivax infection, there is a lot of asymptomatic stages which happens in the liver, and many times it goes into this form called hypnozoid, and then it stays dormant, and then it comes back as a relapsing case of malaria. And there is no liver model outside the body where you can study it, because the 2D culture has like 0.1% of infection success, because you need a lot of other molecular markers to establish a host pathogen relationship outside your body in the plate. So we are developing a disease model based on these organoids, and so NCBS CCamp, that environment is very good for it. But at one point when you graduate and when you really need to move out of the academic environment, I think we are coming very close to that point, and we are moving out to Bangalore Bioinnovation Center, which is in the Electronic City near IBAB. And so yeah, we are making an expansion of our labs over there.
Awesome.
So,
My last question. So, what's the future for Pandora? What happened?
It was disconnected for a second.
Oh, okay. So what's your future, and what do you like? You were talking to me about what you are looking forward from CSG and from the members. Like that would be like your vision. Yeah.
Okay, so basically, I would like to see myself as an academic entrepreneur. So right now I'm doing my postdoc in EMBL Hamburg, and this is on basically the molecular signalings of neuronal wiring. And it sounds kind of like not fitting to the story that at the same time you're doing postdoc and at the same time you're also kind of running a company with your other co-founders. But the idea is this, that what I realized, when you're in the model of a business, it's very difficult to do blue sky research, because again the same thing, like there is not much practical sense of funding it. And there are great models like Robert Langer, based in MIT. And then somebody whom I knew personally very well during my PhD, Professor Tom Blundell, based in Cambridge. So these were examples to me as people who have been successful, super successful faculties in different institutes, but at the same time they could manage to take their initiatives to the industry and bring their science out to the market. So this is something which is, I would say, as I see as my future path. And the future path for the company is, of course, as I was talking about, into transplantable organs. But there are a lot more things to do. I think we are in a super exciting time when biology is being enriched by convergence of so many different fields. So many new things are opening up. Like, for example, humanization of an animal tissue is possible through turning on specific genes and all through CRISPR, which is becoming more and more, like we are starting to use it in our company. Then a lot more things are going on. So I will say that I can't even say what is the future. I just know what is the future for me in coming 2 to 3 years, and that's how it's been working out.
Right.
And the reason for which I'm in CSG right now, so basically I was visiting New York. It's just on the way to Cold Spring Harbor Lab, one of the conference which I'm going to attend. And I've been I've been not very active, but I've been very inquisitive about the activities of CSG, and I think it's a great initiative. And for me personally, I want to use it as a platform to hire, because we are looking for hiring postdocs with very good scientific skills, but not only just that, also who knows how to take care of a team and be a team leader. in Panduram. And right now, like, we have an active session of hiring which is going on. So I'm looking for people who would like to come back to Bangalore, who has experience in these kind of fields, like, which includes stem cell derived, like iPSC and different kind of cell lineage derived methods, or developmental biology. Definitely a good synthetic organic chemist, and yeah,
And
yeah, you know.
I'm only 50 minutes drive from your place, electronicity.
Yeah. Because we are also working on a lot of integration of peptides to mimic the cell-cell interaction and cell attachment into the matrix. So this will be a nice place to look for people, a nice platform. And also at the same time, I see in coming 2 years, we are making outposts outside India, and one of the places which is strongly in my mind is either in Boston or in San Francisco. So this is also a scouting tour for me to see how things are. So,
Right.
Yeah,
So when you are, so now you're talking about hiring, right? And
Yeah.
you know, one of the reason we wanted CSU was that people should get hired after PhD.
Yes,
So what are
sir.
the core competencies which you are looking at? Like, for your company, what are you looking at? Who will be the best fit?
So right now in the company there are 3 different segments. One is the biomaterial segment. So biomaterial segment is like people who has background in peptide chemistry, click chemistry, like conjugation of peptide into different kind of polymers, and also tweaking and hydrogel system. So this is the biomaterial part for now. Then comes the cellular biology part. So we are looking at people with good skill set in stem cell and developmental biology, that and also in genetic manipulation of cells. Say for example, one thing which we find extremely challenging is if, let's say in case of liver biopsy, you don't get a lot of starting material. And now the idea is to take primary cells from the patient and then grow into an organoid, which is like a replica of like it's a personalized organoid basically. And then you can so then you can use it for drug testing, you can use it for disease model, but for these kind of cases, what we find very limiting is the ability of primary cells to divide. I mean, they're differentiated and they don't divide and they don't even survive well. But there are different kind of lentiviral methods and also CRISPR-based method through which you can tweak specific cellular pathways and make them proliferative for, let's say, 40 to 50 cycles. So these kind of work we are looking at. And then co-culturing them with mesenchymal stem cells and endothelial cubex. So these are the kind of cellular biology background people we are looking into. And on the other side, the machining side, we are recruiting people with engineering background who can tweak with, who can basically build 3D printing for specific kind of uses. Like, let's say for example, we are using 455 nanometer of light. So building a 3D printer with a specific resolution with these kind of targeted light, targeted light which will be able to modulate some specific parts. So like to incorporate spatial information in a small resolution, in microscopic resolution. So these kind of customization of 3D printing devices and microfluidic chips, because at the end of the day you need a small bioreactor. So there are lots of things coming together, and that's what also getting back to your question. Like Arun comes in because of his engineering background, and he has been working in aerospace department, but his work was on nanoparticles, functionalized nanoparticles, which he wanted to use as a catalyst for rocket engines, for rocket propellant. And that's where it comes up, because also one important part of this is when you want an activated surface, you want a high amount of mass to surface ratio, surface to mass ratio. So many of these manipulation of material at the nanoscale gives you a massive amount of surface area, like microporous nanospheres or electrospun nanofibers. So that actually enhances the diffusion surface, active surface you can give. So all these things are together, and we are basically looking for people from all these different fields. And,
I think this is very good fit to me. My background also, that what you are working on.
Yeah.
My background is like that, and I know people, Robert Langer and
So I know Langer and Kadmoizini.
yeah, I know also.
Okay.
So I went MIT actually for a week,
Okay.
and I visit their lab, and I know personally.
So Stephen Summit worked with Langer for a very long time, and Stephen Summit is the person who was one of the jury's member.
The Wharton guy.
Yeah, and the Wharton School of Business. He's a professor in Wharton School of Business, but he also leads a lot of movements in tissue engineering and tissue transplant. And historically, this Brigham's med. Yeah, exactly. I keep stammering on the full form. That has been a place where the first transplant happened, and a lot of these people,
And
Vacanti,
there is 3D
Langer,
printing
yeah,
also and everything.
exactly, yeah.
They're very good.
So he's the one who introduced me to that ecosystem,
Okay.
and then first to Langer, and then to Kadmoizini and
Ali.
yeah, Ali.
Awesome.
And very good expansion microscopy and optogenetics tool we can use like that.
Yes.
I know the person who is the famous, and we can discuss
Sure,
later.
absolutely.
And I have a
Excellent.
background on nanobiotechnology, electroscope, scaffold. So I basically, what you are working on liver, I work on cancer model.
Okay.
So I generate on breast cancer model. My experience background is breast cancer. So we try to use 3D scaffold. We have an intake and that we can talk about.
Sure.
So we have like 3D culture and we are doing repurposing of the cancer drug. Because,
Okay.
drug formation, there are so many drugs, but nothing was for some time. So, and that time there is not good technology. So now technology is available.
Yes.
So now we are trying to do repurposing of the same drug, old drug, and we can use different
Right.
drugs. So to overcome the drug resistance cancer drug. I mostly work on cancer background. What you are working on liver. But same concept is same.
Right.
Yeah, but the important thing is, I mean, liver is the starting material also because of the commercial interest, because hepatotoxicity is one of the main, but
Exactly.
it's just one of the starting point. Because once you build a platform, then the next thing is kidney or like any kind of.
lung and everything.
Actually, it's much easier to make an organoid of a system which in your body modular. Like in liver, you have modules, and then it's multiplicated. Same is in kidney. For which you don't have modules multiplicated is your brain, and that's why I want to keep that on my academic side, because at one point it can merge.
Awesome.
Yeah, that
Tuhin.
the guy I talked about, the guy who is working on optogenetics, he's in on doing brain science.
Absolutely.
I
Yeah.
can give you
Yeah,
that.
retinoid receptors. Yeah.
And they are kind of this. And Houston MD Methodist, they're also good in the lung and that transplantation is very good.
Right.
I visit there also for a week.
Very
So, and there is a Rice University Nanotechnology Center, they're very good.
awesome. Just a minute. So so I will just Tuhin, just give the final pitch, 1 or 2 lines.
So I'm in CSG for the next step, which is to take talented and ambitious people who wants to make a transition from academia to industry. But I can say one thing for sure, that in Pandoram, something which you will not miss is the stimulating science, which basically the first reason for which you are in academia. And the second thing is, like right now when I talk about it, I talk in context of India, but sometime hopefully soon in future we are expanding out to Singapore, and most likely even in either Boston or San Francisco in the US. So let's keep this discussion going on, and I'll be very happy to get
Awesome.
yeah.
Awesome.
Yeah, I think in Boston.